Well, good morning. Ahead of Halloween and with 5 more days of voting, I want to begin this morning by continuing to encourage Marion County residents to exercise an abundance of caution. Continue wearing masks when around others in public. Wear masks that are effective and wear them properly. When in line to vote, maintain 6 feet of distance. Voting is our most sacred right. And frankly, it's also our most fundamental obligation as a democratic society. And in a year of historically high turnout, in which voting in person is the only option available to many of our neighbors, we must do our part, each and every one of us, to ensure everyone can vote and vote safely. Second, one of the most effective tools to understand and to reduce the spread of COVID-19 is the contact tracing that our health experts do after a positive case is confirmed. However, many tracers have not been able to make contact with the people who have been potentially exposed and infected with COVID. These individuals may simply not answer the phone or have hung up to the very call that would let them know that they have been exposed and are therefore vulnerable. Please answer your phone. I know that goes against our modern instincts, but phone calls are the primary way that remote tracers are able to contact you if you have been in any position of vulnerability. In addition, the Marion County Public Health Department, in partnership with IUPUI's School of Public Health, will be encouraging more asymptomatic contacts to get tested. This is known as surveillance testing and can help track the virus within populations. Today, we are beneath the 10% positivity rate that acted as a threshold for our earlier mitigation efforts. However, we know enough about this virus to say with certainty that if we do not take seriously our current health orders and our own personal responsibilities as citizens, this rate will continue to go up. More of our neighbors will get sick. Some will die. And the only option available to us may be to return to more stringent mitigation efforts. So finally, I want to address a question that I have heard over and over again from those who are concerned about the economic health and well-being, the economic sustainability of our city, specifically our downtown. The question I get asked often is, when will major employers send workers back to the offices that they occupy under normal circumstances, downtown particularly? And I can't answer that question on behalf of a corporate community that I trust and that I know have the best interests of their employees in mind. And a corporate community that has certainly stepped up to the plate to offer assistance to our city and to our state during a global crisis. But what I can say is that the refrain I have heard over and over again from business leaders is that when they look at factors that drive their decisions, including the positivity rate that I just mentioned, they aren't just looking at Marion County alone. That's because now, more than ever, we must recognize that we have a regional economy in the Indianapolis metropolitan area that covers many counties throughout central Indiana. As such, the public health strategies that will lead us to defeat this virus and set us on a path toward recovery, by their very nature, need to be regional as well. So today, I am announcing that with Dr. Caine, our intention would be to request and convene the public health departments of our 8-county area in the coming weeks to begin working on what I hope will result in more regional collaboration on policies and practices that acknowledge that our foe in this fight does not recognize county lines. We'll have more on that topic soon. So let me just end by saying once again, I know it is troubling that as we head into the winter, we are still fighting this virus. And fatigue set in a long time ago. But this morning, I will renew my request that each and every one of you take care of yourselves and do what is currently asked of all of us that enables us to help take care of our neighbors. Wear a mask. Listen to our public health officials, especially when they're trying to contact you. And if you've been exposed, get tested, even if you are not symptomatic. A negative test is still valuable information in our fight against COVID-19. Now, for updates on our latest data, I'm proud and always honored to pass it over to the director of the Marion County Public Health Department, Dr. Virginia Caine. Doctor?
Thank you, Mayor Hogsett, and so appreciative of all those new changes, especially from a consumer standpoint, that's going to be required in order to not only slow this epidemic down, but actually be able to eliminate this epidemic so that we can get back to a near normal life. So we look very forward to it. If I could have the first slide. Second slide. One of the things that we've been happening is just in the last couple of weeks that we've now seen almost across the country, nearly 35 states are saying they're seeing a significant increase in their cases, and especially the hardest hit has been the Midwest. And as you can see on this particular map for Marion County, we had done well for a while, but we started around early October, starting to see a slow increase gradually continuing to climb along with the state of Indiana, which we've seen many counties across the state of Indiana also starting on this upward slope of new cases. And in some parts of the state, we find that hospitals are near filled to capacity with their hospitalizations. There are now 9 million cases in the United States, 9 million. There are 45 million globally across the world. Next slide. Next slide. So one of the disturbing things and challenges that we have faced recently is we had at the end of September had reached a positivity rate below 5% for nearly 2 weeks. Incredible, great results back then. But if you will look, since the end of September, you started to see the rise of our positivity rate till we are now continuing. It is a slower spread than the state, but it is a steady increase that is occurring so that now we are at a 7% positivity. Now, what do we say? There are two factors that we look at to know we're doing a fantastic job. And that is where you have to have your positivity rate, percentage of the people who are positive in a community that get tested in a day, and we look at 7-day averages. And so if you're below 5%, that's our gold standard. And now you're seeing that we are slowly reaching up to 7%. And a word of warning, if we reach double digits, you may find that we may have to go back and retract and go back to a lower stage of requirements compared to where we are today. So watch this positivity rate, and as it gets to double digits, that's a major, major concern for us. And we're hoping that this positivity rate will very soon slow down and plateau. But it will all depend on consumer behavior. It all depends on all of us in this community, whether we make that turnaround, and we need to make it soon. And if you see in that smaller graph, look where we were in April, and we were doing fantastic. But as Mayor Hogsett says, we do know fatigue sets in, but this is the time and point that you have to be the strongest. We are near the finish line. Help us be a winner. Next slide. The second most important criteria are how many new cases we are seeing on a daily basis over a 7-day average. And as you will see, we were at 100 cases per day around about late September. And even earlier than that, in September, we had reached down to 84 cases on a daily basis. But we saw our cases steadily climb and are still climbing, where we are now at an average of 209 cases occurring each day. Our gold standard is actually less than 35 cases per day is the goal that we are aiming for. And so remember those 2 points, 5% positivity and less than 35 new cases per day happening in our community. Next slide. And this is our ED visits. So right now, we're very fortunate in Marion County compared to compared to a number of counties in the state of Indiana. And that is, we are having some increased visits for emergency room visits, where we were averaging in late September about 18 new emergency room visits per day. We have now reached up to like 27 visits per day. And so that is not even an increase of 10 more emergency room visits. So we're starting to see it trickle in, but still very, very low and nearly almost the same as at the start of our start of this pandemic, when it started in March. Next slide. Hospitalizations. So what are we seeing from a hospitalization standpoint? Well, we had gotten up to like having about 10 admissions per day for people diagnosed with COVID-19. We had been down as low as about 8 visits back in late September, 8 visits. We peaked up to about 11 hospitalizations per day, but we've now been sort of down on the decline, down to 8 hospitalization admissions per day. So you can probably say this, we're sort of been kind of flat in terms of our hospitalizations for COVID-19. So we're very fortunate. And why are we fortunate? Because the fall season is here and we're going to see more respiratory illnesses pop up that is going to be a tremendous burden on our hospital folks, our community health centers, our private doctors' offices, private providers, healthcare professionals. And so very concerned related to this, but so far we're holding our own steady and not seeing the significant increases that are occurring in different parts of the state of Indiana. Next slide. So our deaths have gone up since October, beginning of October, but we're still seeing less than 2 deaths per day. So we're averaging less than 2 deaths per day. So we're still looking in terms of the significant mortality related to this coronavirus that we are very positive in terms of so far addressing the pandemic from a significant illness standpoint. Next slide. This may be a little bit difficult for you to see in the background, and so I'm sure you can request the slides, but you need to know what's happening in the surrounding counties and where our Mayor Hogsett says it's going to be so critical that we may have to have a regional approach and we have to speak with each other in terms of our plan to control coronavirus. So we've seen in Boone County, where in mid-October, they went from seeing 13 new cases per 100,000 population to 27 cases. So they've literally doubled their cases just in 2 weeks. The same has occurred for Hendricks County. They have doubled their new cases in 2 weeks per 100,000 residents. Basically, Morgan is a county that has been relatively flat and have not seen the significant increase we're seeing like in Hamilton County, which has gone from 13 cases to now 23 cases in a 2-week time frame per 100,000 residents. And Marion, we have gone from 16 cases to 23 cases in a 2-week time frame. Johnson County has also actually been flat, but they have a higher rate of infected residents in Johnson County, and starting out at 26 cases or 28 cases, 26 cases per 100,000, and been flat at 27 cases per 100,000, but at a much higher rate, a much higher number of their residents have coronavirus than any of the other counties. Hancock has gone up, and Shelby County has just gone up dramatically from about 10 cases up to all the way to 45 cases. They've like 4 times the number of new cases in just a 2-week time frame. So this is a similar problem that is happening throughout the state of Indiana. And hopefully we can put a lot of bright minds together and talk about how we can work with innovative solutions to help address all of our needs in our particular region. Next slide. Now I have the good news. So let me tell you about some of the good news. When we look at our children and young adults, and we look at, and that age group is between 0 and 19 years of age, you will see that in October, where in September, 20% of our cases were of our young children and young adults, 20% of our cases, we are seeing our COVID-19 cases decline down to 14%. So that's very positive news. We're continuing to do great control from an infectious disease standpoint of our K through 12 children, as well as our 18 to 24 years of age. But I have to give you this caveat. We got Halloween coming up, okay? People will go out and play, not wear their masks, or they may wear their Halloween mask, which is not the same as a cloth mask or surgical mask. Let me repeat this. You may have a lot of fun. And it's not only children, I worry about the adults, where you're not wearing appropriate masks and doing your 6 feet distancing. So I have to be concerned about that. I have to be concerned about many schools are having fall breaks. And sometimes when you're having a fall break, you know, you want to have some fun, and it may create that you're not following the recommendations that we give you. And then lastly, it's so important when people are going to be voting out there, wear that mask and do your social distancing. As Mayor Hogsett says, we have got to do those major 3 things. So those are the 3 factors where we're looking good for our children. We can be impacted negatively as a result of those 2 events. Those 2 events, and even our young adults who may be voting out there. So we want everybody to vote, but we want you to be safe. Now, unfortunately, we are seeing an increase now in our seniors who have COVID-19. We went from 11% last month of seniors taking over and contributing to all of our cases, and now that has increased to nearly 16%. So we have seen a 5% increase in the number of cases in our seniors. So we have to watch that very carefully. And we're also seeing a 5% increase in our 40 to 59 years of age individuals. So everyone, be careful of your seniors, if they're your parents, if they're your friends, okay? We've got to be very vigilant in making sure we safeguard them and keep them safe. Next slide. This is just a little better picture for all of you out there who are parents or grandparents, very interested in your children. So I'm going to tell you this from a distance, and this is based on just the different grades, ages from 0 to 19. So if you look at that very last map, you will see that the bulk of our cases are in the very dark blue are in our 18 to 19-year-olds, okay? And that's been relatively almost stable. And then when you look at our 14 to 17 years of age, you can see there's been a slight decrease for these last 2 weeks compared to the prior 2 weeks for the 14 to 17-year-olds. These are our high school students, high school. So we've seen a substantial decline in our high school students. We've seen even the yellow bar has gotten significantly smaller, and these are 11 to 13 years of age. These are our middle school kids. And we're seeing a decrease in our 5 to 10-year-olds, our elementary students. We are seeing a slight increase in our 0 to 2 years of age, but our kids that are primarily in school, these numbers going through October the 17th, October the 17th, actually to the 24th, is showing that we still have very good infection control with our children. And if you just went about a month later, the month going back, look how long that blue bar was for our 18 and 19-year-olds. And so, again, we've had an incredible accomplishment, and I continue to commend all of our hardworking teachers, all of our hardworking university and college administrators, our superintendents, our principals of our school. Everyone is working very hard to make our environment safe and make our environment for our staff safe as well. Next slide. So in order to summarize this, we are making no changes to our current public health order that we have. We have to reemphasize, wear those masks when you are out in public and you are cannot do 6 feet distancing. Wear those masks. And can I give a special shout out for those folks who enter a retail facility? They will wear that mask coming into that facility, but once they get in the stores or the facilities, they will pull their mask down. Some pull it down to their neck. Some pull it down below their nose. I need for you to be able to wear those masks correctly. And always remember, any child that's 2 years and under should not be wearing a mask. It is dangerous for them, okay? Or you have any children that doesn't have the ability themselves to pull that mask down when they're in trouble, do not give them a mask. Make them have an appropriate alternative process, such as a face shield or whatever, in terms of doing that. And let me tell you the other thing. We've got to stop large gatherings. Please, no large gatherings if you can make sure that that can be preventable. And so we can't have, say, very large wedding gatherings, where, people like to kick up their feet and dance a little bit, okay, and what have you. And you may be doing more eating and drinking where you're not wearing that mask. And so that's just an example for you to think about. So socially distancing is so appropriate and will make a difference for our community spread. As Mayor Hogsett said, contact tracing is crucial. Please answer that phone, that text, or email. You are saving lives. And we now know that because of the Fairbanks prevalence study, we know that for every person that we have tested positive for COVID-19, there are roughly 10 more people with the disease that are unaware of their status. Let me say this again. So everyone that we test that's positive for COVID-19, there are 10 other people, roughly, who have the disease, but they're unaware of that status. So over 40% of people with COVID are without symptoms, and they can spread the disease without knowing it. So they feel healthy, they feel great, they don't have a fever, they are unaware that they are infected, but they can be very contagious just speaking to you within a 6 feet radius. And that's why it's so important to wear a mask and social distance, because it's an important way to prevent disease transmission. So that's why Marion County Public Health Department, we're going to be expanding testing to include any individual who has no symptoms. We're encouraging to get tested. Say, hey, I'm visiting some grandparents. I'm visiting my parents who are over the age of 60, especially if they got chronic medical illnesses. Consider testing yourself and make sure you're negative before visiting a loved one, okay? You may have someone in your household that has some chronic medical illnesses that puts them at a higher risk. Even if you have no symptoms, consider testing yourself to make sure that you are not being a threat to the individuals in your household. You may have someone who's immunocompromised, who's on cancer treatment, or maybe HIV infected. Make sure you are doing testing in order to safeguard any contacts with them. So we are launching a new systematic random surveillance program with IU Fairbanks School of Public Health. They will help to determine the prevalence. This is the amount of disease we have in Marion County, and they will support contact tracing for these asymptomatic COVID-19 residents. We've got to reach them and stop the spread from the asymptomatic carriers. Next slide. So, guys, let me just say, it is, please look at our Marion County Public Health Department guidance out there, okay? I have to help family. Everybody has to help family, right? So my brother's a dentist, so I'm trying to help him out. It's like any of you would do for the rest of your family. So please, kids, keep your kids away from candy. It will cut down on those cavities, okay? And listen, do you know that hard and sour candies, sometimes while biting into that hard candy, there's a risk of fracturing your teeth. You hear me out there? Biting down on hard candy can fracture your teeth. And it sometimes tend to keep the candy in your mouth a little bit longer. And so bacteria can stick around, leave more acid to attack and cause cavities. So it can be very harmful to teeth. And try not to snack on those treats now too. So you can try to treat them as desserts with regular meals if you can, because when you're eating, that's when saliva flow is the highest, and it'll decrease the amount of time that sugar's available for bacteria. But help prevent tooth decay, brush and floss at least twice a day, and please try to visit your dentist at least twice a year. I think that's just really critical. Wear those masks, and don't forget, Halloween masks are not protected when you're out there, and socially distance, okay? Please don't do the traditional trick or treat that we have, and only take any treats from individuals that you know and trust, and organizations that you know and trust. Never allow your children to receive any treats from organizations that you've not investigated and that what they're receiving is safe. Sometimes candy is doctored with medication that is unsafe. And so, hey, Tuesday, looking for a bright day. Next week of voting safely with a mask and social distance. But again, continue to be vigilant after fall break. Thank you, Mayor. That is the summary of my presentation. Oh, I have one, I'm sorry, Taylor, I have one last slide. I forgot, please. And this may be the most critical thing that Mayor Hogsett and I did together. One last slide. Get your flu shot. Please. We're going to have a double whammy this fall. This is so critical. It saves lives. We see anywhere across this country 15,000 to 60,000 people who can die from influenza, the flu. And you even have the possibility of getting the flu and coronavirus at the same time. So roll up those sleeves on your arms, get that flu shot, and it will protect not only you, but protect your colleagues, your friends, and your loved ones. It may make the difference for us in our total response to the coronavirus, how well we get everyone provided with immunizations for anyone 6 months and older. So 6 months and older, so important to get that flu. And Mayor Hogsett forced me to get my flu shot because he got his. And you know, I mean, it happened so fast, I didn't even know it happened, okay? It was very painless in less than a second. So, hey, everyone, enjoy this flu season safe. Thank you, Mayor Hogsett.
And with that, we will open it up for questions. As usual, if you put your name and outlet into the box, we will unmute you and you can ask your question of Mayor Hogsett or Dr. Caine or anyone else on the call. Our first person up is Sherry Rodasky from Indy Star.
Hello, Dr. Caine. I'm hoping that you can hear me. I'd like you to elaborate a little bit more on the random surveillance program that you're starting with the Fairbanks School of Public Health. And I'm also wondering if you could talk about over the summer when you set rubrics or metrics for schools, the positivity rates, those numbers that you were using were at that point, I believe, unique individual numbers. And the state has now switched to presenting numbers both as unique individuals and as all tests. So I wonder if you could talk about the difference between those two positivity rates, which ones Marion County is going by, and explain why you chose that as opposed to the other one.
So there are two tests that are done, and there are two methods that are done. And there's not necessarily no right or wrong to any of those methods. But the difference in both methods is one of the methods includes that from the time you started the epidemic back in March, it accounts for all people tested comprehensively from all the way from March up to now currently. So it gives you sort of a positivity rate overall, combining all of the months in terms of making that determination of positivity. We, in turn, like the method where we're only interested in the positivity rate at the current moment, usually for the last 7-day average and a 14-day average, because, you know, when we were so heavily hit in April, we had tons of cases and whatever, and then we got down where we dropped our cases at a lower level. So it may give you a better, the first one, the method gives you a better idea of how much COVID-19 that you had in your community over time. But the method we use, where I'm not interested in what happened in April in terms of the coronavirus cases. I'm only interested in the active infections that are going on now in the last 2 weeks. That to me gives me a better idea of trends about what's currently happening in the community than a comprehensive type of look at what the overall impact of coronavirus happened in our community since March. So those are the two differences in terms of the methods that we use. And normally you will find, because of that, the test that shows the lowest positivity rates are usually the ones that have a more recent, what we call incidence, the number of diseases that are carrying just at a very recent basis. Whereas the comprehensive test that is done takes into account all the tests that have occurred back since March, April, May to now.
Great. Our next question is from Sam Quinn at the IBJ.
Can you hear me? Yes, okay. My question is for the mayor. Can you talk a little bit more about this collaboration you want to see among other counties, and maybe elaborate on whether or not you've spoken with leaders in those counties about whether they think this is necessary?
Yeah, I have not yet, nor has Dr. Caine contacted our regional partners, and so we will be reaching out over these next few days and weeks ahead. So I can't give you an honest assessment of what our regional partners how they would react. Although I think it's pretty logical to assume that if we are working together, it will make us stronger, not weaker. And obviously, a regional approach is particularly important when you look at the economic effects that the pandemic has had, particularly, as I mentioned in my opening remarks, for those employers who, to this day, and as I'm led to believe, perhaps well into 2021, have residents of the contiguous counties who work oftentimes in downtown Indianapolis, but have been working remotely for reasons that the employer appreciates, the safety, the public health and safety of their employees, and they have not yet authorized a return to work. Now, I trust the judgment and the wisdom of those employers, but I do think that if some of the concerns that employers may have are based not just on Marion County numbers, but also on numbers for employees that they may employ downtown or somewhere in Marion County, but who commute into Indianapolis for work when authorized to do so, I think it only makes sense that to not only assist our public health professionals in making decisions, but also I would hope it would have an advantageous effect on decision making by our businesses in the central Indiana area. So again, to reiterate, the announcement that I just made this morning for a regional approach and regional collaboration, I think is reasonable. I think it's logical. I think it will be helpful. And as a result, I would assume that, we're not going to have meetings just to meet. We'll probably talk as we do in these updates remotely. But the more we know about what each other is doing as a region, I think will strengthen our fight against the pandemic.
That's great. Our next question is from Eric Berman at WIBC.
Good morning, Mr. Mayor. Good morning, Dr. Caine. Couple of questions for Dr. Caine on the testing. When we say we're starting this with Fairbanks, are we encouraging people to get tested? Is Fairbanks going to be reaching out to a sample? What exactly are we envisioning there, and how many additional people do you expect to get tested? And then secondly, if I'm following you, this is not part of Fairbanks. This is a separate testing recommendation, the suggestion of getting tested even if you're not symptomatic. How often do you recommend people get tested? If you live with someone who's immunocompromised, or you go to school, or things where you have frequent contacts, how often should you be getting tested?
So I think that, I think it depends on the nature of the type of person they have within their home. So for example, I might have a spouse that just went through a transplant in their home, but I have to get out of the house on a regular basis, maybe go to the grocery store, or I have to pick up medications at a drugstore. Someone who is in a household with a very, very high risk individual, that I might get a test once a week. Someone in, let's just say I don't visit my parents often. So if I don't visit my parents often, maybe I'm going to get that test like a day or 48 hours before I visit my parents, depending on how frequently I see them. And those individuals might just want to get a test once a month. So it can vary based on the underlying condition that they have. And our goal is to find those individuals who are unaware that they're infected and they're contagious and they're spreading disease.
Our next question is from Hillary Powell at WFYI.
Hello, can you hear me? Okay, so thank you so much, Dr. Caine. We know that this month you announced record lows for the Black infant mortality rate, but unfortunately we lost a Black mom during childbirth this month as well, Dr. Shanice Wallace. Can you please speak to the Black maternal mortality rate? I know you've been passionate about it in the past, about how Black moms face this disparity no matter the socioeconomic status.
So Black moms from a maternal mortality standpoint have nearly about 3 times the rate compared to their white counterparts from a maternal mortality standpoint. Some of this are related to underlying conditions such as hypertension, diabetes, related to their care. But the most important scary thing related to Black maternal mortality as well as infant mortality, and there's a difference. So maternal mortality is the death associated with the mother who dies within a year of a pregnancy, and it's related to pregnancy complications. So that's maternal mortality. What we found was that about 4% of Black mothers only get into care in the first 3 months of their pregnancy. Only 50%, a little over 50, about 55% get into prenatal care. So that means 45% don't get into that type of care. I think Latino women, it's about 44%, okay? And white females get in at 75%. So if you're starting late in your pregnancy, you may have a simple bladder or urinary tract infection can cause the baby to be born prematurely, okay? A low birth weight, which sets them up for higher complications. But the other issue is your blood pressure may be sky high and you don't know it as a result of the pregnancy, leading you to be at risk for a stroke, okay, related to your pregnancy. You may have your diabetes may be out of control, and you might not have even had diabetes until you got pregnant. And so it's those critical early months that we need to have our Black mothers get into care. Poverty contributes to it. A primary care provider, if they have not identified, may make it difficult. But even public transportation, sometimes we have contracts with our taxi cab company who may pick up mom late. So she gets to her visit and she's an hour late and they can't see her. And you know how many weeks it probably took to get that appointment? And then you may have to wait later. So there are a lot of social determinant barriers that we have to address and provide more resources. It is more difficult during this coronavirus pandemic. And so how are we able to maybe bring those resources to them from a mobile standpoint? They may get kicked out or evicted from their apartment, and the stress just related to that. Or, I need to go to food pantry, but I don't know where they all are. So it's difficult from a resource standpoint. So we've tried to have on the City of Indianapolis website where you can go to try to identify these resources, the times and the places of the food pantry. We have a Healthy Start grant where we have a significant number of social workers that are part of the health department. They do a tremendous job. We'll intervene if we think your electricity bill is maybe turned off. We will help assist referrals for housing. There are a lot of things that we provide that we have to do a better job, I believe, from the health department standpoint of continuing to get that message out, whether radio, print, social media, in order to assist our pregnant moms.
Our next question is from Erica Heron at the Indy Star.
Hi, thank you. I wanted to double check with you, Dr. Caine, if you had an update on the school metrics. I think last time we talked, you said you were looking at that 35 new cases threshold for high school coming back for 100% in person. Also, last time you had said that it was safe for middle school to go back full time. I'm wondering if you still think that's appropriate. And then I have another question to follow up after that.
So first, let me say, we still think it's safe for middle school students to come back in person. We're based on our data now. But in terms of have we finalized our school metrics yet? I think for us right now, we're concerned about Halloween, how it can impact our numbers. We're especially concerned about fall break with people being off and maybe doing some things because, it's their time for them to have some fun and some enjoyment and spend time with their family members. And so we're just not as sure from a infection control standpoint how successful these families will be. So we want to wait until after the fall breaks are over for schools. And you normally have to wait about 2 weeks afterwards because that's the incubation period for that virus that can cause disease, for us to know that we have a safe environment for our kids to go back to school for high school. But right now it's looking good. And most of our fall breaks are coming near the end. So we'd like to have some great news for all those high schools who want to come back in person. We may be able to have that answer very soon with our metrics.
Okay, thank you. And then I just wanted to follow up on what Sherry was asking earlier about using the unique individual number versus the all tests number, like all, even over the 7-day average for determining those, the positivity rate thresholds you have for schools. So like the 5%, 10%, 13% numbers. Those numbers are for the all tests over the 7-day average and not the unique individuals. And why is that the appropriate number to be looking at, I guess?
So why do we look at 7-day average as versus an individual test answer? Is that what you're saying?
No, so looking at the 7-day average, there's, two. There's the all tests positivity rate, and then there's the unique individuals positivity rate. The state started reporting both of those. So the school metrics that you set, like the 5%, 10%, those numbers, do those correspond to the unique individual positivity rate or the all test positivity rate? And is that still?
It's usually the all test positivity rate.
So those numbers are still appropriate when looking at the all tests instead of using the unique individuals that we were looking at before.
Yes, so usually the unique individuals, I believe, positivity rates are much higher than all test positivity rates.
Right. So that's why I'm asking. So that higher number is not what we should be thinking about when we're thinking about reopening schools. You want us
Right.
to be looking at the lower number.
You want to be looking at the lower number, yes.
Dr. Caine,
Okay, thank you.
Yes.
you should probably also clarify the difference between the two, especially because the unique individuals doesn't account for the fact that sometimes people get multiple tests over the course of a 7-day period, which is generally the better estimate of prevalence, which is how we're going to be able to make decisions about schools opening.
Good point, Paul. Thank you.
Great. Our next question is from Russ Dodge at WITT.
Questions here. First, Mr. Mayor, just reconfirm the new grant program for November 1st to provide the siding and tent and heaters and the likes of that to help the restaurants and other businesses use outside capacity. And then the second question regards the early voting. What's the holdup in using Lucas Oil Stadium for early voting, given the phenomenal crowds that have been showing up at all the satellite voting locations?
Yeah, Russ, I'll throw your first question to Thomas Cook to give you an update on our help initiative. But let me take your second question first. It's encouraging that so many people are fulfilling their civic duty by early voting, in spite of wait times, in spite of bad weather, in spite of this ongoing health crisis. It's very encouraging to see so many people participating, but it is unacceptable that those challenges exist in the first place. Wait times, inclement weather, and then, of course, wearing masks and proper social distancing. So I was happy to see yesterday's announcement that the hours for early voting here at the City County building have been extended to 9 p.m. Now through Sunday. And Lucas Oil will be opened this weekend as another voting site. I talked to the Marion County Clerk, Mila Eldridge, just the other day, and certainly let her know that if the election board takes actions that require additional resources, I committed to Clerk Eldridge that I would work with President Osley and the City County Council to ensure that Marion County has the funding and the support that they need to expand over these last few days of early voting. So Lucas Oil will open up this weekend. The hours here downtown at the City County building have been extended to 9 o'clock. And we stand ready to provide additional assistance if necessary to assist in those 5 areas of early voting centers throughout the county. I might say that I wish we had more, but that's my own personal opinion. I think the nature of the turnout has been phenomenal and is good for our democracy, but unfortunately, it causes problems at the polls. Thomas, you want to talk a little bit about the help grants and the $1 million offering for businesses and restaurants to enhance the outdoor dining experience as deep into the winter as we can possibly enhance it.
Yeah, I appreciate it, Mayor. So just for clarity's sake, there are 2 different grant programs that were launched by the City of Indianapolis thanks to an appropriation by the City County Council using our CARES Act funding, our remaining CARES Act funding. The first is the cleverly named Hospitality Establishment Lifeline Program, the HELP Grant Program. That program has been up and running now for a couple weeks. And as of, I think this morning, there had been about $11 million worth of inquiries from Marion County businesses, nearly $9 million of which are represented in completed applications, both the landlord and the business themselves having completed their portions. I will say one encouraging sign we've seen, and this is due in no small measure to the outreach that the Indy Chamber did on our behalf, and some work by Ms. Camille Blunt and our Office of Minority Women Business Development. We've had roughly 43% of those applications be represented by women or minority-owned businesses in the community, and we've seen a lot of success in our outreach in trying to ensure that we're going to overcome whatever barriers exist to getting this program up and running and helping those who are most in need. That program offers $25,000 worth of grant funds for rent or mortgage assistance. But as the mayor mentioned, there's a second program that will be, I believe, live tomorrow. Applications go live. It's the Ready for Winter grant program. It's a supplemental $1 million program that offers up to $2,500 worth of reimbursement for restaurants, bars, and other entertainment venues to help them acquire whatever PPE or other equipment they might need in order to have outdoor seating continue to be available throughout the winter months. You can find out more on that program at response.visitindy.com/winter. Visit Indy has graciously partnered with the Capital Improvement Board to administer this program. The one thing I would say on Dr. Caine and Paul's behalf is we are encouraging canopies as a way to have weather-proofed areas outdoors, but we do not want people to be putting up tents with 4 sides. This is, if you enclose your outdoor seating, that is just enclosed seating. So please don't have more than 2 sides be covered. I know that a lot of businesses, especially with wind or inclement weather, may want to adjust where those 2 walls are. But if you're just setting up indoor seating outdoors, that is not what we're trying to accomplish here. And obviously the health department and the city stand ready, along with our Department of Business and Neighborhood Services, to help whatever businesses may require to plan for the winter months.
Janet Williams, State House Files. Oh, it looks like there may be some technology issues there. We'll go to Eric Berman at WIBC, who I believe had a follow-up.
Yeah, wanted to go back to the Fairbanks testing for a second. Dr. King, could you clarify, are people being encouraged to get tested if they've not had contacts, don't have symptoms? Is Fairbanks going to be reaching out to people and asking them to come in and get tested? How many people are we expecting to include in that surveillance testing?
So I don't know the exact numbers yet. We'll have to talk to Dean Haverson and the staff over at the Indiana University Fairbanks School of Public Health, and Dr. Nir Minacci, who led the prevalence study for the state of Indiana. And so I don't know the exact numbers, but we are going to try to have probably some kind of campaign, promotional, social media and whatever, really trying to encourage individuals who have no symptoms to get tested. Because we've got to identify those individuals. So we may be trying to really encourage businesses, organizations like church members. And so we're really trying to also, from a racial and ethnic standpoint, trying to make sure that we're representative of those groups. And so I know they have a plan in terms of how they are going to address this. And so maybe we can have them on a future interview in order to address those questions.
Great. Well, thank you all so much for joining us. We will send out a copy of Dr. Caine's presentation following this. Wait, I'm sorry, Dr. Caine, do you have one more thing?
So I just this was, I think, such a great win for our city that for the history of Marion County, we had the lowest ever Black infant mortality rate since we were #1 in the country back in 1984. And I want to say that our deaths at 10.9 deaths per 1,000 live births was phenomenal, because when we were #1, we were at 25 deaths per 100,000. So a lot of work related to that. And also, I got to give kudos to our Latino community, because they had the highest breastfeeding rate in this community at 87%, followed by our white mothers at 81%, and our Black mothers at 75%. We always have to address that smoking, and our maternal smoking was highest among our white women at 13%, compared to Black women at 8%, but only 2% of our Hispanic mothers were smoking. But let's address that first trimester at 75% for our white women, 53% for our Black women, and 44% for our Hispanic women. We are really going to have to really focus on that. But I think this is a huge accomplishment. And we have a Indianapolis Healthy Baby Consortium that have been great partners with us. And so we just want to thank all of our partners in the leadership here in with Mayor Hogsett and the rest of the community in making these substantial gains. And we want to continue to get to that point. Thank you so much.
Great. Thank you all for joining us today. The copy of Dr. Caine's presentation will be going out shortly.